Hi, so this video today will be discussing iatrogenic factors that cause miscarriage. We believe that many doctors and medical professionals want the best for their patients by effectively diagnosing and treating their conditions. But most often than not, despite their good efforts, these patients end up developing these iatrogenic factors that cause their future miscarriage. They are most often caused by not giving proper and accurate diagnosis and treatment, which means these patients will end up miscarrying their next pregnancy. This type of cause of miscarriage is known as iatrogenic cause of miscarriage, which means they are caused by medical professionals or medical error. So most often than not, these iatrogenic factors that lead to miscarriage happen because of these doctors not having a comprehensive and in-depth knowledge in the field of recurrent miscarriage. Furthermore, they are also not providing the most proper and comprehensive diagnosis and treatment, which is why these patients are not effectively treated and then they end up miscarrying in their next pregnancy. So I'll be talking to you about a few factors today. The first of all, the most common one is induced abortion. So many patients and couples, they end up choosing to go for induced abortions, or they might be recommended by their doctors to go for induced abortion to terminate their pregnancy. Now, induced abortion, this procedure is very damaging to the uterus lining of the mother, and furthermore, it also poses a significantly high risk of introducing fetal tissue into the mother's system, which will trigger an immune response. So in future pregnancies, she will develop an immunological condition causing her miscarriage that will happen over and over again. So this is actually directly caused by the recommendation of many doctors and the patients themselves choosing to it because of a lack of knowledge in this field. So the proper way of terminating pregnancy should be using hysteroscopy procedure, because hysteroscopy does not harm the uterus lining, does not cause any secondary damage, and the fetus or embryo can be carefully removed from the uterus without causing any damage. And then it also significantly reduce the risk of introducing any potential fetal tissue to the mother, so she won't suffer from any immunological miscarriage. So the second iatrogenic factor is how a first-time natural spontaneous miscarriage has been aggravated into a recurrent miscarriage. So in this condition, right, when patients experience their first miscarriage and they go for their doctors to check up, they are most often told that stuff like this happens and that it's nothing to worry about, things happen, or it could be just like bad luck, which is why they had this miscarriage. So they are often advised to just go for their next pregnancy, it will be a success. But then because of this type of medical advice, these patients end up miscarrying again because they have not received any proper and effective diagnosis for their underlying condition, and also not receiving the accurate and specific treatments for their condition. Because of this type of iatrogenic factor, they end up miscarrying the next time, aggravating their initially very simple and first-time miscarriage into a much more complex condition, which is getting harder and harder to treat. The third iatrogenic factor that causes miscarriage is doctors not attempting to save or prevent threatened miscarriages. So threatened miscarriages are miscarriages that are about to happen but not yet. So these type of patients that experience symptoms such as vaginal bleeding and abdominal pains during their pregnancy. The baby is still alive, but they experience these types of symptoms, which means a miscarriage is about to happen. So when they go for a doctor's checkup, right, these doctors will just say, this is happening because of the nature of the embryo itself. The embryo or the fetus is not healthy. So they should just let nature take its course, let the miscarriage happen, go for an induced abortion, and then try for your next pregnancy. But here in Antai Hospital, we know that this type of advice is wrong, because if the threatened miscarriage happened this time, it will also happen in your second or next pregnancy, because threatened miscarriages are usually caused by organic diseases of the reproductive system. So the proper way is to actually quickly go and diagnose and provide any treatment, because threatened miscarriages can be saved as long as it is found and treated in a timely manner. The fourth iatrogenic factor that I will talk about is managing or handling threatened miscarriages wrongly. So many cases, doctors will actually take the threatened miscarriages seriously, but their methods and treatment methods are actually wrong or inaccurate. For example, they will actually depend on over prescription of hormonal or vitamin pills for patients with threatened miscarriage, and in this type of case, right, excessive use of this type of pills, right, will actually cause more severe complications. For example, excessive uterine bleeding due to the development of placenta accreta, or also the feminization of a male fetus. In the case of actually an example, uterine fibroids, if there is a uterine fibroid found during her pregnancy, these doctors will recommend termination of the pregnancy and then allow the mother to undergo hysterectomy. So not only does she lose her pregnancy, she ends up losing her reproductive organ. She becomes from a miscarriage patient into an infertile patient. So although these threatened miscarriages are being taken seriously, but they are not being handled with the correct method. The next iatrogenic factor is one of the most root causes of iatrogenesis, which is incomplete diagnosis and incomplete treatment. So in many cases, right, doctors will think that certain diagnostic tests are not necessary because they have already identified certain causes for your miscarriage. But they already stop at the first and second factor of your miscarriage, when in reality miscarriages are highly complex and there can be many factors in play. For example, there can be up to 4 or 5 complex reasons that are causing the miscarriage. So although they have identified the first 2, they stop there and they will give her the treatment, and this patient will still end up miscarrying in her next pregnancy because factor 4 and factor 5 has not been identified. And furthermore, and similarly, incomplete treatment is also what's causing these iatrogenic factors. Incomplete treatment, for example, in cases of multiple uterine fibroids, the surgeons most often than not, they will only remove the fibroids that are visible to them. So those that are very small or not visible to the eye of the surgeon are not removed, and they are left inside the uterus. So although they do not affect her current pregnancy because they are very small, as time passes, they will grow in size. And when she gets pregnant again, these uterine fibroids were initially, when they were very small, they do not affect the pregnancy. But now that they have grown in size, they will end up causing a miscarriage due to the incomplete treatment of the surgeon. Finally, the last iatrogenic factor that I'd like to talk about today is herbal supplements or alternative medication. So many patients like to rely on these herbal supplements or alternative medications, believing that it can somehow prevent them from suffering from miscarriages. But these medications are being prescribed to these patients without any scientific basis, no proper diagnosis, or any factors that is specific to the root cause of their condition. So more often than not, it's actually an experimental type of treatment because it is not specific or accurate to their root cause. So it is also known that miscarriages are actually caused by organic diseases, which means there must be some dysfunction or disorder of the organ, which in this case is the organs of the reproductive system, that is causing the miscarriage. And organic diseases need to be treated with surgery. It is only effective if it is treated with surgery. So medication and herbal supplements have little to no effect in treating organic diseases. In conclusion, we believe that couples do not have to suffer these types of recurrent miscarriages if they have been given the proper guidance, the proper treatment, and proper diagnosis initially in their first miscarriage. And iatrogenesis, not only does it waste their time and money, it also aggravates their condition into much more complex situations, much more difficult to treat, and also sometimes aggravating them into infertility, which means they will no longer be able to get children. So all of these can be prevented, and iatrogenesis should be taken seriously. In a study published by University of Johns Hopkins Medical School in 2016, it was determined that iatrogenesis illnesses are the 3rd largest cause of death in the United States alone.